Doing an amazing treatment. We talk about this a lot, but you don't see it as much because we don't show it as much. My patient had surgery, and you could see his arms are very sculpted, his shoulders and biceps. We actually injected some Bellafill with Voluma a few months ago into the arm, and now we're gonna do that again. We're gonna build up his biceps a little bit. This is gonna help him extend. Is this the one side?
Yeah, this is dope.
Okay. We're building up the biceps using a combination of filler, just like I do penile rejuvenation. We do it in the shoulders, we do it in the biceps, we do it in the chest, in the buttock, in the calves, and you could do this to build collagen in these areas and give volume. The peak of his bicep, you just have to tell me when I'm at half. Okay. The peak of his bicep is significantly better, and this is going to help him when we get him back to the gym to really build more, because the PMMA that's in the Bellafill will build a lot and build collagen here. I actually can feel internally, I can feel some of that collagen that's already been built because of thickening in the area. Now, this is a cool treatment if you guys even have a small area, let's say a medial part of a calf or the area in the shoulder, like where we just want to cap. You can already see, good or more? Still more? Okay. Where we can really build. I've gotten Marvel characters ready for movies with this on their traps and other areas before. It's not a cheap procedure, but it's definitely something you can do. Even on abs, we can do it to build a six-pack. How much more? Okay. I just want to show you guys when he's flexing. That's why. So we're going to finish. We have 2 more cc's to build this up.
Someone wants to know, is this painful at all?
How does it feel right now? No, there's actually some numbing inside. This is a cannula, so it really shouldn't be too painful. For both sides?
No, for the other.
Oh, you have the other. Yeah. Okay, got it.
Separated.
Cool. It shouldn't be that painful now. The initial poke, there might be a little bit, but not that much. And so we're shaping, rounding it, just getting the right angles.
Can you do this without having to get surgery?
You can. You don't need to have surgery to have that. So I want to show you guys, just flex slightly because I don't want it to come out. Flex a little bit more. Good. So you guys could see we built that peak up. He now has about a ½ an inch more in roundness, and then what's going to happen is it's going to elevate over the next few months and build. So that's his bicep on this side. You see the shoulder into the deltoid insertion, bicep and tricep all separated. So that's really going to help him build up. Now I'm going to do a little bit in chest. So give me the needle. I'll do chest now. So we're going to do one little pinch. He's going to feel that a little. Sorry. Not the best. Not the best. Got it. You guys see, I marked this I call this the gladiator area, or we call this shield portion of the chest, which is the upper part. Actually has some good size still. Go ahead and take that. This part he'll feel, which is a little bit, hold on. There we go. Sorry, little pinch. There. Once it's in, we'll have the numbing in there and he'll be okay. So there's numbing inside. Usually it takes a few pinches. You'll feel. It's not the best, but it's easier than doing it with a needle. You get really bruised with a needle, and there's also a chance more of a hematoma or something, which we don't want. So again, going through.
How long until you can go back to the gym?
So I told him to wait about 3 days. Want the swelling to go down just a little bit, but he can pretty much go after 3 days. And so again, I'm going to focus mainly on this upper portion because I really want to lift the chest a little bit. Should be feeling a little bit better now because there was numbing inside.
Yeah.
And it's really just that initial, poke. That's just a little irritating. Or towards the middle. But it's a very safe procedure when done right. And you guys at Emer University, I was teaching people and some of these things on how to do body fillers. So if you guys want training, we have training courses. We don't have another filler one set yet, but we will soon if you guys are interested. This will also be a part of the surgical training portion that we'll have set up very soon. So stay tuned for that. If not, We have our penile rejuvenation. We have our acne scar treatment, Emer University in the next couple weeks. So check that out for LA. And then another one in June for New York.
So also, how long can this be expected to last?
So the PMMA is permanent. The voluma that's mixed in is about 2 years. So this will give him at least 2 years of some size, but development that's bigger over time because the belly fill is going to build. So technically permanent. I've seen people where we do this once or twice and they literally have a permanent for years. I've had patients 10 years. At that time, we were only using Juvederm and not voluma. So that's really it, you guys. This is using filler to build body muscles. You can do this on other areas like the buttock too. Contact us anytime if you're interested. Take care.